Ozempic face. Let's talk about it. So in the more recent years, we have seen the rise of drugs like Ozempic and the Ozempic family. And we've actually discussed Ozempic and the Ozempic family in a previous video. Now, when I say the Ozempic family, I mean the semaglutide family that includes Wegovy, Mounjaro. And if you remember from my previous video, and if you don't, look here and click on the link, then you note that Ozempic is actually the drug that is prescribed for diabetic patients to help with control of insulin resistance. As a byproduct, it has also been found to incur and induce weight loss to the degree that there are other drugs in its family that are specifically prescribed to patients who require weight loss. Wegovy and Mounjaro, among the few. We are seeing now massive weight loss happening in patients who previously would have had to have more invasive measures like bariatric surgery. So remember that bariatric surgery includes things like the gastric bypass, the gastric sleeve, and the point of bariatric surgery is to restrict and to induce malabsorption of nutrients so that you have weight loss. And so with those surgeries in the past, we have seen patients who can go from 300 pounds to 200 pounds within the span of a year, and that is officially massive weight loss. The difference that we note between bariatric surgery and drug-induced weight loss is that the cutoffs are a little bit different. So for instance, if a patient wants to seek out bariatric surgery, they need to prove two things need to be true. They either need a BMI of 40 or over, or they can have a BMI of 35 or over as long as they have another condition associated with weight gain or obesity. Things like hypertension, diabetes, are diseases that are associated with obesity, that if a patient presents with that and is a BMI of 35 or over, they are a candidate for bariatric surgery. Now, with the semaglutide family, what we actually see is that patients need only a BMI of 27 with an associated disease process. So 27 with hypertension or diabetes or sleep apnea or one of those, or a BMI of 30. So the cutoff has been lessened, which makes sense. Bariatric surgery is more of a upfront commitment surgery, obviously, which has its own increased risks, but also its increased rewards to some extent. So when I say Ozempic face, what we are seeing is a face that's associated with pretty high degrees of weight loss. Now, it's not new in the sense that we haven't seen it with people who have been very obese, who have had bariatric surgery and lost massive amount of weights. But when you compare that to the population that is now taking semaglutides, that population has increased. And then with the popularity of the weight loss drug, we've seen even celebrities who wouldn't normally be considered overweight or obese now be able to have access to resources that they once did not. And so Ozempic face literally is the same face that we saw in patients with massive weight loss, but in a population that's greater, but also a little bit smaller to begin with. So we're still seeing rapid and massive weight loss, but in patients who were already smaller to begin with, and so their results can make them seem quite different and noticeable. Now, if you look at examples of people online who have been described as Ozempic face, and I'm not here to call out anyone in particular, it's not my job, but if you Google Ozempic face, you will see pictures and images of people who have had a fuller face to begin with, and then a more gaunt face once they lost a lot of weight. Two things are true about patients either with massive weight loss from bariatric surgery, diet and exercise, or even Ozempic, and that is that one, you see a loss of facial fullness, so you see a loss of facial fat, and then because of that, because you've lost a good amount of fat, you also see some sagging of the skin. Now, how does one deal with that? Well, it's the same way we deal with aging in plastic surgery. It's the same way we deal with patients who have had massive weight loss as well. We address sagging skin and we address lack of facial fullness. So remember, loss of facial fullness doesn't just happen in patients who have had massive weight loss or rapid weight loss. We also see that normally with facial aging, right? As we age, we lose facial fullness. I say that quite a bit. on here. So the same tools that we've had in the past for addressing facial fullness loss or facial fat depletion as a result of facial aging still holds true for the use of either a weight loss drug, weight loss surgery, or some kind of massive weight loss remedy that's caused a rapid change. If you deflate something, you must inflate it. And how do we do that? So we can either use filler or fat. So filler comes in typically 1 cc syringes. It's typically considered to be a temporary solution. Filler is typically composed of hyaluronic acid. And so in that way induces plumping with kind of increased water absorption of the molecule. And then as well as it can help to stimulate collagen production in some cases of filler. Filler normally lasts anywhere between 6 months and a year, but as we can see in patients, especially with pillow face, is that it can last longer and it can migrate. So filler is actually not something that I prefer to use for patients with facial depletion or facial fullness loss over the years, because to be able to do it smartly, you would need a good amount of filler to do it. That can be expensive. It's temporary. You can have migration of the filler. So there are actually a lot of downsides to using filler. And so my preferred method is actually fat grafting. So fat grafting, you take a little bit of fat with liposuction from anywhere on the body that you feel like you have a little bit of extra. Typically that's the belly, but it can be the legs. It can be the arms. We can take that fat, process it down to the micromolecule and sometimes the nanomolecule, and then inject it into areas where we've seen facial fullness loss, I should say. The downside of fat grafting is that you may need more than one session. With every session of fat grafting, we lose between 30% and 50% of the fat that we inject at any given time. So it may require you to have more than one session of fat grafting. It also can be a more invasive procedure because we are doing lipo at the same time. You may require some additional anesthesia besides just local anesthesia. So your doctor may recommend general anesthesia to do it. And so those are the downsides. But I think overall, fat is right? We don't worry about fat migration like we do with filler. And so I think for patients particularly who have had massive weight loss, either by bariatric surgery, diet and exercise, or Ozempic-like products, fat grafting is probably the way to go to restore facial fullness. In terms of sagging of the skin, that's removal of excess skin, right? And so typically that looks like a face lift, a neck lift to address those issues. Typically incisions come down in front of the ear and around and behind to be able to accomplish that. So in my mind, this brings up an interesting would you rather. Right? Would you rather have a pillow face or an Ozempic face? And I think for me, I'd rather have an Ozempic face, because I know that there are very curative ways that have very predictable results. And so then we can address them very easily. Is it more expensive? Probably. But in pillow face, because you're kind of just injecting filler everywhere, the ability to control the response to effectively address the pillow face can take more time and can take more patience. And I don't know that I'm a patient person. I kind of like to have my results quickly. That's why I became a surgeon, so I could see my results quickly. That's my answer. But anyway, that is Ozempic face in a nutshell. How we treat it, why it comes up. And then the last question is, would you rather? So you know my answer, but what's your answer? Comments and questions below. Please like and subscribe. And as always, love you lots, and bye for now.